welcome to iHealthConnections. I'm your host, Dr. Rashmi Nair. This episode, we are talking about Medicare Part C, Part D, and Medigap policies. Joining us today for our discussion is my close friend Umesh Menon, who is a leader in the finance and banking industry. Hello Umesh, welcome to the show, continuing on our discussions on Medicare from last time. Today we will focus on Part C, Part D, and Medigap policies.
Thanks for inviting me, Rashmi.
Let's get into the next one, which is Medicare Part D. Can you elaborate what Medicare Part D represents?
Medicare Part D is the prescription drug coverage specifically for people who are on original Medicare, which is Medicare Part A and Part B. This particular coverage provides prescription drugs that is needed and can be covered through only a Medicare approved plan. So each plan can have cost variance depending on the type of drugs being covered. Bare minimum is that they have to have at least a standard level of coverage that has been set by Medicare. Medicare drug coverage has both the generic and brand name drugs. So the plan list of prescription drugs that's covered called the formulary. How these different generics and brand name drugs are placed into different tiers and what is covered and what is not covered. That is what a formulary is. Plans generally have different monthly premiums. So depending on what your needs are, you have to choose the plan that you would really like to be enrolled in.
Okay, now that we covered Medicare Part A, B, and D, let's talk about Medicare Part C, which you mentioned is a Medicare Advantage plan. So, what is Medicare Part C?
Medicare Part C is called as Medicare Advantage or MA plans. Simply put, it is an all-in-one alternative. It means that you don't have to pay a separate premium for Part A, Part B, and Part D. All of that gets covered under one part, which is Medicare Part C, because this is offered by Medicare approved private health companies that have to follow the rules that is set by Medicare. Medicare offers a fixed payment for the care that is provided to Medicare enrollees through Part C. Because Medicare is paying that monthly payment to these private health companies, whatever is being covered by original Medicare has to be covered under Medicare Part C. Now, they have additional benefits. For example, vision, hearing, and dental. These are things not covered under original Medicare. The cost or the premium that you pay cannot be more than what you pay for your original Medicare.
This is a good example where a private insurer is able to deliver more than what the government health program is delivering through the Medicare Advantage, right?
Absolutely. Some plans even cover gym memberships and they might even offer you discounts. Other plans might offer coverage for transportation to the doctor's office. Because everyone already has the Part D built into it, they will have additional services for over-the-counter drugs and services that they will offer for your health and wellness. And you can also tailor the package based on your needs. If you have a lot of chronic conditions that you want to manage, then the health plan can be more catered towards you. You can customize it and therefore it is more beneficial.
I mean, all in all, it seems like a better deal to me. In general, what are the costs for the Medicare Advantage plans?
The cost for Medicare Advantage cannot be more than what is being paid for the original Medicare. The cost will vary. The coverage varies by the carrier, which health plan you are enrolled in. Depends on that, depends on the area you are, depends on what type of plan you choose. Your monthly premium will change. But yes, it will not be more than what you will pay for your original Medicare. One more advantage of being in Medicare Part C is that there is a limit on out-of-pocket cost, which is not available in original Medicare.
So Medicare Advantage has a lot of advantages. It looks like completely lopsided. Is there a catch that people should know about?
The catch is basically that you have to stick to the network and the service area if you want to have lower cost, and if you want to make sure that there's not so much money that you have to shell out, then it is basically stick to the network. You can always call the plan and check before you use any benefits to see are there any other limitations. Generally, as long as you're staying in network, you should be fine.
Got it. What about the enrollment? How do you go about doing the enrollment here? Like, how do I enroll into a Medicare Advantage plan?
For Medicare Advantage, enrollment period begins on January 1st and goes through March 31st of every year. Now, there are different types of Medicare Advantage plans that you can choose. You can be in a health maintenance organization or an HMO plan, or you can choose preferred provider organization plan, which is a PPO plan. Now, if you have specific services that you're looking for, you can choose private fee for service or enroll into a special needs plan. The only difference, for example, in an HMO plan, there is a primary care physician that you have to either select. The primary care physician or a PCP is a gatekeeper in an HMO plan. So whenever you have to go and see a specialist, you need a referral from your PCP, and that PCP is your to-go person. So that's how they control cost in an HMO plan. And if you choose an HMO plan, that will be the lowest cost for you. Now, PPO plan offers you a little bit more leeway. It means that if you are going to choose a PPO, you don't have to go and see a PCP every time you want to go and see a specialist or any other doctor. So there is no gatekeeper in a PPO plan, therefore your premium will go up as well. Advantage of HMO or a PPO is that the prescription drug is already included, but when it comes to the private fee for service or if you come to the special needs plan, it depends on the type of plan. Sometimes they might not be offering you prescription drug or the Part D in your plan.
Interesting. It still sounds like a better option compared to the original Medicare.
Yeah. One key thing to remember is if you are enrolled in an HMO or PPO plan, you cannot buy a separate Medicare prescription drug plan. If you do, then you will be disenrolled from your Medicare Advantage plan and switched back to original Medicare. The only enrollees who can buy a separate prescription drug plan are those enrollees who don't have a prescription drug coverage that is offered by the health plan. For example, the medical savings account plan or the private fee for service plans, they might choose to not offer a drug coverage. In those cases, these enrollees could go and buy a separate Medicare prescription plan. Otherwise, it's a strict no-no.
But why would someone who's enrolled into a Medicare Advantage plan still feel the need to get the prescription drug coverage, which is the Part D?
Enrollee might not know when they were enrolling that what kind of services are covered and they did not look through it. How much you know before you enroll into a plan. Know what your needs are. Based on your needs, choose the plan. If you have a lot of chronic conditions, make sure that you're looking at your formulary and the drugs that you have for your conditions are already covered. If not, you will be unhappy with your plan.
Makes sense. I mean, that's a lot to digest, especially that, we went through the whole plans and a Medicare Advantage plan is much better than the other plans. As a conclusion to the Medicare Advantage plan, can you just give, us a key takeaways on what people should take away from Medicare Advantage, just to break it down?
Yeah. So simply put, these are the things that you need to know. In Medicare Advantage, you are getting Part A, Part B, and Part D covered. In addition to that, you will also get vision, hearing, gym benefits, transportation to doctor's office, depending on the type of health plan you choose also. But yes, there will certainly be more benefits than what you can get in original Medicare. But you need to stick to their network. As long as you're staying within the network, your out-of-pocket cost is low. It is beneficial for people who are sticking to one particular service area. For snowbirds in particular, if you are planning on going to warmer climates during the winter, make sure that your health plan does offer and cover services in those areas before you choose a plan and before you make a move. People do not think about it because they're now out of network. That's one. Overall, Medicare Part C is very beneficial. Few key things that you need to remember. Even if you are in Medicare Advantage plan, you should keep your Medicare card safe. Just because your coverage is offered by a private health company does not mean that you're not part of the Medicare program. You're still in the Medicare program. You still have the Medicare rights and protections. Make sure that you keep your card safely. The last thing that I want to leave my listeners with is there is no restriction on pre-existing conditions. You need to make sure that if you have specific services that you're wanting to use, call the health plan and make sure that it is covered. And plan can provide more information or have contacts who will work with you to make sure that your needs are being met.
Got it. You also don't need to buy Medigap when you're enrolled in this, right?
Yeah. And in one line, if I just want to sum what Medigap is the backup coverage or coverage that is chosen by the Medicare enrollees for the gap in original Medicare. Only original Medicare enrollees need to buy Medigap. In fact, if you're on Medicare Part C, you cannot buy a Medigap policy.
Can we also get into some details about Medigap?
Sure. When we were talking about Medigap is for gaps in coverage for services that Medicare Parts A and Part B doesn't cover. There are 10 different plans of Medigap that you can buy, options that you have. If you take all current Medigap plans that is available, most of them do cover 100%, but at least a portion of these costs should be going towards the Medicare Part A co-insurance and hospital costs that enrollee has to pay out of their own pocket. It also goes towards Medicare Part B co-insurance or co-payment and Medicare Part A hospice care co-insurance. All the co-payments and co-insurances and everything that the enrollee has to pay out of their own pocket or for services that is not covered under Medicare Part A or Part B gets covered. Example, 3 pints of blood, which is not covered under the Medicare Part A. When you're in a hospital inpatient, then that gets covered by Medigap. But one thing I want to clarify is that Medigap is not Medicare Advantage. So it will not cover the dental exams and the eye exams or eyeglasses. These things are not covered.
Okay, so that's interesting to know. There are like 10 different Medigap plans. Can you just give us a view? Like what is the difference between these plans?
Yes, there are 10 different types of Medigap supplement plans that's available, but all these offer the same basic benefits with some additional benefits offered by certain plans. You can choose the plans based on your needs, and depending on which state you are, there are more standardization for certain plans. It goes from Medigap Plan A to all the way to Medigap Plan N.
Let's get into the cost. For Medigap plans, what's the cost per year?
Well, Medicare supplement insurance can cost as little as $1,300 a year, which comes to roughly around $100 a month, or it can go to $2,000 a year, depending on the most popular plan, which is Medigap Plan F. Starting January 1st, 2020, the Medigap plans cannot cover the Medicare Part B deductible, and therefore insurance companies will not sell Plan C or Plan F after January 1st, 2020.
2020, not 2021, just so I'm clear.
Yeah, so everyone who has been enrolling into or who has been choosing Medigap plans, after 2020, you don't have Plan C or Plan F available. Everyone before that had it.
With regards to cost, what is the key reason for the differences in cost?
The main reasons of difference in cost is attained age rate in the Medigap plans. So your current age determines what the cost is. So a person who is over 75, their cost would be different from a person who is 67. Second is community rated. So this premium is tied to the community plans and it is not based on your age. So your premiums can increase over time based on inflation and all such factors. The third one is issue age rated Medigap, where your age when you first buy is determining what your premium is. Younger you are when you buy the Medigap plan, the less it costs. So if you start at 65 and you're already enrolled into Medigap at that time, you will be getting a low premium versus someone who decides to choose a Medigap policy at the age of 70.
How does the Medicare supplement insurance or Medigap work?
First of all, you have to have the Medigap plan you choose. First, Medicare pays for it, whatever their share, and have to pay your cost. So your Medigap plan pays what your portion is, depending on the type of plan you bought.
Where can you buy these plans?
You can buy a Medigap plan from any private insurance company, but before you can buy any of these plans, you should be enrolled into Parts A and Part B. And you will have to pay a monthly premium to the private insurer. It is not included as part of your original Medicare.
So that brings me to the next question then. When do we buy the plans? When does someone buy this Medigap plan?
You can buy a Medigap plan at any time. Most people buy these plans during the 6-month Medigap open enrollment period. That starts the same month you enroll into Medicare Part B. If you miss that open enrollment period, you may not be able to find any insurance company that will sell you a Medicare supplement plan. And even if you do, you might actually end up paying a higher premium than if you had bought during the enrollment period.
Oh, okay. So it's beneficial to kind of time yourself correctly and buy during that period. Can someone buy more than one Medigap plan?
You cannot buy more than one Medigap plan. If any insurance company gets to know that you are on a second Medigap plan, then it is illegal.
And can a Medigap policy cover both the spouses?
No, Medigap policy is based on the person. So one Medigap plan covers one person. So you and your spouse will need to buy separate policies if you want coverage.
On an overall level, can you explain what the difference is between the Medicare Advantage versus Medicare Supplement, which is also called the Medigap plan?
Yeah, so Medicare Advantage is a plan which is an alternate to original Medicare, which is Part A and Part B, hospital insurance and medical insurance coverage. And they usually cover a lot more benefits like dental, vision, transportation to the doctor's office. But Medigap, on the other hand, are plans which pay some of the cost that original Medicare enrollees have to bear, which is not covered, like the deductibles, the co-insurances and co-payments. So there is a big difference between the two.
That definitely helps. And what's the difference between Medicare Select and Medicare Supplement?
Medicare Select is a Medicare supplement plan which are sold in certain states. And Medicare Select plans mostly tend to be cheaper than the other Medigap plans. It is only available in certain states. They also require that you use the hospitals and doctors within a specific network in order to get full coverage.
Let's talk about the gap that you're referring to in the original Medicare. I think you called it the donut hole. Is that right?
Absolutely. So it is referred to as the donut hole, or it is the coverage gap that we keep on referring to when we talk about original Medicare. In order for me to explain what this coverage gap is, there are a few things I want to clarify before that. For example, deductibles. Deductibles are amount or a payment that is paid by the enrollee out of pocket before the plan starts kicking in. Out of pocket cost are any cost that the enrollees have to pay for services that they obtain as part of the cost that is being borne by the enrollee, and the remaining being paid by the health plan itself. Out of pocket can be co-payment or co-insurance. So these are the key things. A benefit period in Medicare Part A, which is basically the hospital insurance, begins the day you go into a hospital or a skilled nursing facility and ends when you have been out for 60 days in a row. If you go back into the hospital after 60 days, then a new benefit period starts and the deductible will happen again. But you would be responsible for any deductibles, one for each benefit period, as long as the enrollee goes into the hospital after that 60 day when they got discharged. The second benefit period kicks in. If you do not have a 60-day gap between the second admission and your discharge, then you're still in that first benefit period. So that's the benefit period, right? The next thing I want to cover is the lifetime reserve days. Lifetime reserve means it's a total number of days, which is 60 in case of Medicare. You have 60 lifetime reserve days. And these 60 days can be used only once, meaning that once you use them, you will not get it back. In a benefit period, on the other hand, every time you have a new benefit period, your coverage again automatically resets. Original Medicare covers 90 days of inpatient hospital care each benefit period. So every benefit period you have 90 days of coverage. That's not the case for lifetime reserves.
So the 90 days basically resets every year that you enroll, while the reserve period is throughout your lifetime, which is 60 days in total.
Correct. Exactly. These are the two key things we need to clear: benefit period and lifetime reserve days. In order to explain the coverage gap, take the case of a patient. Neville has been admitted to the hospital in January. In the first time frame, she stayed for 5 days. She got discharged after the 5th day in January. She gets readmitted in April and stays for 65 days. Since there was a gap of 60 days that passed between the release date, which is the discharge date, and the readmission date, the second admission in April now is a second benefit period. She had to pay a deductible in the first benefit period. Since this is a second admission, she has to pay a deductible again. In 2021, the Part A deductible is $1,484 and the daily co-payment that is required is $371. In the first stay that she had, her Medicare Part A deductible is $1,484. For day 1 through 5, she doesn't have to pay anything. It is $0. The deductible $1,484 applies by benefit period. The first benefit period she stayed in for 5 days, she had to pay that deductible of $1,484.
The whole amount.
Whole amount, yes. She's still in that coverage frame of 1 through 90 days, which Medicare covers. She doesn't have a copay during this time, so it's $0.
Okay, but then if you're still in the first benefit period, you don't have to qualify for the deductible. Can you now talk about, okay, let's say 60 days has passed and now what happens?
Every benefit period, the deductible has to be met again. If John is admitted into the hospital in January, stays for 5 days, and then he is readmitted again in early February and stays for 3 days, he is still within that one benefit period. He will only pay one deductible because it's still that one benefit period. So his deductible is $1,484. In either scenarios that we looked at, as long as within one benefit period, the person has not used 90 days of care. That 90 days of care, the way it is divided is, there is no daily copay for 1 through 60. But day 61 to day 90, there is a copay that has to be met. That's the $371. In the case of Neville, once it's day 61, she will start paying that copay of $371 for how many ever days she is going to be in that hospital or skilled nursing facility.
Oh, wow. So she has to start over again, meaning she has to meet her deductible and then the copay goes away, or copay is $0.
Let's say that Neville stays past the 90-day time frame. She has few choices. That's where the lifetime reserves come in. The choices are, she says, I'd rather not pay it. I'm going to use my lifetime reserve days. In that case, she can go ahead and use lifetime reserve days, which is only 60 days of lifetime reserve. So if she uses all 60, it's done. There is no more lifetime. You will not have any more replenished lifetime days for any other time frame. Let's say she has finished using her lifetime reserve days. Medicare will stop paying for all inpatient related hospital costs after that. So if she stays still in the hospital, Medicare will not pay for that coverage. She will have to pay all of those. And that's the gap. Even the $371, from a perspective of a senior who is not working, is on Medicare, doesn't have other sources of income coming in, $371 per day, it adds up if you're in the hospital for a long time. That's a huge amount of money for them. So that is a coverage gap. It's a donut hole. Initially, you pay a deductible, then you don't have to pay anything because original Medicare kicks in. Now, after a certain number of days, you're still responsible for all these remaining payments that's coming through, to a point where Medicare completely stops covering anything for you.
After 90 plus 60 days.
If you don't use your lifetime reserve, then it is obviously at 90 days. 91st day, you start paying for everything. Because you can decide, I'm not going to use my lifetime reserve right now, I'm going to use it later, and so you can keep it.
Within the benefit period, let's say I was in the hospital or someone's in the hospital for 80 days and they get out. After, let's say, 50 or 60 days, they re-enroll into the hospital for same or different reason. In the benefit period, do they just have 10 days remaining?
In that one benefit period, if they are in the same benefit period, they only have 10 days of coverage as per Medicare. The Medicare covered only 10. If it's a new benefit period, then it resets at day one.
So when you say benefit period, basically means that year or the next year, right? Because these are yearly benefit periods.
No.
Okay, it's not.
What is the time frame between the release date and the readmission date? That is how a benefit period is determined. A benefit period is continuous as long as you are in the hospital or gets readmitted. If there is no gap of 60 days, that benefit period you fall into the same one. If there is a gap of 60 days is when you have a second benefit period.
Not to draw a loop, as long as you maintain like a 2-month gap between your hospital visits, you're basically covered. The benefit period resets again.
Yes. If we imagine an individual who has had a 120-day Medicare covered inpatient stay, which means they used 30 lifetime reserves also, in addition to the 90 that was covered.
Yep.
And now they have been out of the hospital for 60 days in a row, they will be eligible for another 90 days of hospital coverage because that will be a new benefit period.
Correct. So this is convoluted is like an understatement here. This is as complex as it gets.
Yes, it is. Benefit period resets after that 60-day gap in a row. Taking the example of that 120, it means this patient has only 30 days left of their 60 lifetime reserve days because they already used 30.
Understood. This donut hole, it only applies to Part A? That's right?
No, it applies to Part A, Part B, Part D. The coverage gap is existing in that original Medicare world, not in the Medicare Advantage world.
Okay. That's basically what you're highlighting.
One more thing our listeners should know is that let's say you're in a hospital for more than 90 days in a single benefit period. The hospital will start deducting days from your lifetime reserve if you have to be over the 90 days.
Yeah.
You have to let the hospital know if you want to use your lifetime reserve days or not.
They just start seamlessly, taking out your lifetime unless you tell them not to.
Correct. There is a time frame by when you have to let them know. You can let them know while you're in the hospital, or you can let them know up to 90 days after you leave the hospital that you did not want to use it as a lifetime reserve day. When you make that decision, you should know that you will be required to pay for the full cost of care that was not covered after 90 days, however you plan to use it.
All right. So what else do we need to know about this?
If you have extra help, which is a federal program that helps pay for some of the out-of-pocket cost of Medicare prescription drug coverage, then you don't have a coverage gap. You do not have to worry about Medicare Part D coverage gap.
Oh, okay. So it is relevant for Medicare Part D as well, meaning for the drug coverage. That's what you were saying earlier. Well, Rashmi, this has been a great discussion on the different parts of Medicare and an awesome breakdown on what it means, what it entails, what the costs are, how people can enroll for it. And to me, it was really insightful. Again, thanks for your time. I really appreciate you taking the time and going through.
Thanks, Umesh. Medicare is a complex topic, but I had fun doing this episode with you. Thanks for listening to this episode. Want more from me or want to be a guest on my show? Whatever it might be, you can go to iHealthConnections.com and drop me a note or comment in the contact section. I'll be covering a lot of some very cool stuff, so be sure to subscribe to the iHealth Connections podcast so you don't miss any new shows that I put out. You can also find me at Dr. Rashmi Nair on Twitter. Thanks, I'll see you around.